Let's face it, nobody enjoys talking about what happens in the bathroom. It's one of those topics that people tend to avoid, but it's crucial to bring it into the open. After all, our health and well-being depend on understanding every aspect of our bodies, even the less glamorous parts. But when it comes to our health, it's important to address even the uncomfortable topics. Ignoring them can lead to bigger problems down the line. That's why we're here to talk about hemorrhoids, a condition that many people experience but few discuss openly. Hemorrhoids, those pesky, swollen veins in the rectal area, are a common ailment that can cause a great deal of discomfort. They can be internal or external, and their symptoms can range from mild itching to severe pain and bleeding. Understanding what hemorrhoids are and how they develop is the first step in managing them effectively. The good news is that hemorrhoids are often preventable and treatable. Simple lifestyle changes, such as incorporating more fiber into your diet, staying hydrated, and exercising regularly, can make a significant difference. These habits help maintain healthy bowel movements and reduce the strain that can lead to hemorrhoids. By understanding the causes, symptoms, and treatment options, you can take control of your health and find relief from the pain and embarrassment that hemorrhoids can bring. Treatments range from over-the-counter creams and ointments to more advanced medical procedures depending on the severity of the condition. This essay aims to provide you with clear and concise information about hemorrhoids, empowering you to make informed decisions about your well-being. We'll delve into the different types of hemorrhoids, their symptoms, and the various treatment options available, so you can choose the best course of action for your situation. We'll explore everything from prevention strategies to home remedies and medical treatments. Home remedies like sitz baths, ice packs, and high-fiber foods can provide relief and help manage symptoms. For more severe cases, medical treatments such as rubber band ligation, sclerotherapy, and even surgery might be necessary. Remember, knowledge is power, even when it comes to your behind. By educating yourself about hemorrhoids, you can take proactive steps to prevent them and manage any symptoms that arise. So let's dive in and get to the bottom of this common but often misunderstood condition. Imagine the veins in your legs becoming swollen and varicose. This condition is often visible and can cause discomfort. Now think about how these veins look and feel. They are enlarged, twisted, and sometimes painful. This is a common issue many people face, especially as they age or if they have certain health conditions. Now picture that happening in your rectum. The veins in this area can also become swollen and varicose, leading to a condition known as hemorrhoids. Hemorrhoids are quite similar to varicose veins but occur in a different part of the body. They can be just as uncomfortable and problematic. That's essentially what hemorrhoids are: swollen and inflamed veins in the lower rectum and anus. These veins can become irritated and cause a range of symptoms, from mild discomfort to severe pain. Hemorrhoids are a common condition affecting millions of people worldwide. There are two main types of hemorrhoids, internal and external. Internal hemorrhoids develop inside the rectum and are often not visible. They can cause bleeding during bowel movements, which might be the only sign of their presence. External hemorrhoids, on the other hand, are located under the skin around the anus. Internal hemorrhoids develop inside the rectum and are often painless, though they can bleed. This bleeding can be alarming but is usually not serious. However, if the hemorrhoid becomes prolapsed, it can protrude outside the anus and cause discomfort. External hemorrhoids, on the other hand, occur under the skin around the anus and can be quite painful, itchy, and uncomfortable. These hemorrhoids can cause significant discomfort, especially when sitting or during bowel movements. They can also lead to swelling and irritation in the affected area. Understanding the type of hemorrhoids you have is essential for determining the best course of treatment. Different types of hemorrhoids require different approaches to treatment. For instance, internal hemorrhoids might be treated with dietary changes and medications, while external hemorrhoids might require more direct interventions. In the following sections, we'll delve deeper into the causes, symptoms, and treatment options available for both internal and external hemorrhoids. We'll explore lifestyle changes that can help prevent hemorrhoids, as well as medical treatments that can provide relief. Stay tuned to learn more about managing and treating this common condition. Hemorrhoids are often a result of increased pressure in the rectal area. This pressure can be caused by a variety of factors, including chronic constipation, straining during bowel movements, prolonged sitting, pregnancy, obesity, and even aging. Essentially, anything that puts excessive strain on the veins in your rectum can contribute to the development of hemorrhoids. This includes lifting heavy objects, a low-fiber diet, and even chronic diarrhea. By understanding the common causes of hemorrhoids, you can make lifestyle changes to reduce your risk and prevent future flare-ups. Hemorrhoid symptoms can vary depending on the type and severity of the condition. Internal hemorrhoids often go unnoticed, as they are typically painless. However, they can cause bright red rectal bleeding, especially during bowel movements. External hemorrhoids, on the other hand, are harder to ignore. They can cause a range of uncomfortable symptoms, including itching, irritation, swelling, pain, and bleeding. One particularly painful complication is a thrombosed external hemorrhoid, which occurs when a blood clot forms inside the hemorrhoid. This can cause sudden severe pain and requires immediate medical attention. The good news is that hemorrhoids are often preventable through simple lifestyle changes. One of the most effective ways to prevent hemorrhoids is to consume a high-fiber diet. Fiber adds bulk to your stool, making it easier to pass and, reducing the need to strain. Staying hydrated is also crucial as it helps soften stools and promotes regular bowel movements. Regular exercise, particularly activities that don't put pressure on the rectal area, can also improve bowel function and reduce the risk of hemorrhoids. Other preventative measures include avoiding prolonged sitting, especially on the toilet, and maintaining a healthy weight to reduce pressure on the rectal veins. Section 6, Home Remedies for Hemorrhoids. Finding relief naturally. For mild cases of hemorrhoids, several home remedies can provide relief from discomfort. Warm sitz baths, which involve soaking the affected area in warm water for 10 to 15 minutes several times a day, can soothe irritation and reduce swelling. Applying over-the-counter creams or ointments containing hydrocortisone can also help relieve itching and discomfort. Witch hazel is another natural remedy that can reduce inflammation and soothe irritation. In addition to these remedies, over-the-counter fiber supplements and stool softeners can help regulate bowel movements and prevent straining. Section 7. Medical treatments for hemorrhoids. When home remedies aren't enough. If home remedies fail to provide relief, or if your hemorrhoids are severe, medical treatment may be necessary. Minimally invasive procedures such as rubber band ligation, sclerotherapy, and infrared coagulation are often effective in treating hemorrhoids. These procedures typically involve cutting off the blood supply to the hemorrhoid, causing it to shrink and eventually fall off. In more severe cases, surgery may be required to remove the hemorrhoids. Your doctor can help determine the best course of treatment based on the severity of your condition and your overall health. Section 8. When to see a doctor. Don't suffer in silence. While hemorrhoids are common and often treatable, it's important to seek medical attention if you experience certain symptoms. If you notice heavy or persistent rectal bleeding, severe pain, or prolapsed hemorrhoids that don't retract, it's crucial to consult a doctor immediately. Additionally, if you experience any changes in bowel habits such as constipation or diarrhea that persist for more than a few days, it's essential to seek medical advice. Remember, early detection and treatment are key to preventing complications and ensuring a speedy recovery. Section 9. Conclusion. Taking control of your health. Hemorrhoids can be a pain, both literally and figuratively. They can cause significant discomfort and disrupt your daily life. The good news is that you don't have to suffer in silence. By understanding the causes, symptoms, and treatment options, you can take proactive steps to manage and even prevent hemorrhoids. But by understanding the causes, symptoms, and treatment options, you can take control of your health and find relief from the discomfort. Remember, prevention is key. Hemorrhoids are often caused by straining during bowel movements, sitting for long periods, or a lack of fiber in your diet. By addressing these factors, you can significantly reduce your risk. By incorporating simple lifestyle changes, such as eating a high-fiber diet, staying hydrated, and exercising regularly, you can promote healthy bowel movements and prevent constipation, which is a major cause of hemorrhoids. High-fiber foods include fruits, vegetables, whole grains, and legumes. Drinking plenty of water helps to keep your stools soft and easier to pass. You can significantly reduce your risk of developing hemorrhoids in the first place. Regular physical activity such as walking, jogging, or yoga can also help to improve your digestive health and prevent hemorrhoids. Exercise helps to stimulate bowel function and reduce the time you spend sitting, which can contribute to hemorrhoid development. If you do experience hemorrhoids, don't suffer in silence. There are numerous home remedies and medical treatments available to provide relief. Applying a cold compress can help to reduce swelling and numb the area, while a sitz bath can soothe irritation and promote healing. Numerous home remedies and medical treatments are available to provide relief. Over-the-counter creams and ointments can help to reduce pain and inflammation. In more severe cases, your doctor may recommend procedures such as rubber band ligation, sclerotherapy, or even surgery to remove the hemorrhoids. And if you have any concerns or experience severe symptoms, don't hesitate to seek medical attention. It's important to consult with a healthcare provider to determine the best course of action for your specific situation. They can provide guidance on the most effective treatments and help you to manage your symptoms. Your health is worth it. Taking control of your health means being proactive and making informed decisions. By understanding your condition and taking the necessary steps to manage it, you can improve your quality of life and enjoy better health overall. Remember, small changes can make a big difference.